Good afternoon. As some of you who have heard me speak before may recall, I often like to start with stories of my patients from my clinical years, and today is no different. The reason why I do that is because these people, my former patients, they're really my teachers and my inspiration. And speaking about them, remembering them, reminds me the purpose that I'm trying to serve here. So today I want to talk to you about Pratik. Pratik, I met during a school hearing screening activity that I was part of when I was still working in Delhi in India. He was a grade 5 student, and his teachers described him as being a really quiet and shy, and that he was not too interested in his studies, didn't really engage much or answer in class and so on. When my colleague examined Pratik, he saw immediately that Pratik had bilateral ear infections, and he had hearing loss, moderate hearing loss in both his ears. Thanks to the school screening program, Pratik was diagnosed, and subsequently he was treated in our hospital for his infection, and surgically to repair his eardrums, as well as then there was still a residual hearing loss, so he was provided also with some hearing aids to address that. During the follow-up visits, his parents reported that Pratik was doing much better in class. His grades had improved a bit, and he was much more engaged in class. And recently, not recently, but a couple of years back, I also came to know that he had completed his diploma and he was working in an office somewhere in Delhi. While Pratik was under treatment with us, we also realized that his older brother, whose name I cannot recall, I'm so sorry, he was about 17 years old at that time, and he had exactly the same problem, bilateral ear infection and hearing loss. We could treat his infections, repair his eardrums, also provide him rehabilitation, but he had already dropped out of school. And what we could not give back to him was really those lost years and the lost opportunities. These two boys, to me, exemplify the rationale for this World Hearing Days theme. Hearing care for every child. Because of course, they are not alone. Globally, over 95 million children of school-going age live with unaddressed hearing loss. And majority, the vast majority, over 70%, live in low and lower middle-income countries of the world where services are lacking, where human resources, where devices are lacking. And this, as we have seen, has an impact, a lifelong impact on people. It impacts their language and communication, of course, but also their learning, their education, which further impacts their employment, their financial well-being in future life, and their social relationships. And the reason why this is so important and why it requires public health action is because hearing loss can be addressed. It can be addressed through strategic action that focuses on prevention, that focuses on early identification, and on provision of evidence-based interventions. Prevention, because we know that about 60% of childhood hearing loss is due to preventable causes. Preventable causes such as the otitis media, which Pratik and his brother had, which is the major cause of hearing loss in this age group. And also hearing loss, that preventable hearing loss that is being caused due to unsafe listening to loud sounds for prolonged periods of time, which puts at risk the hearing of nearly 50% adolescents and youth. So prevention, strategic action to prevent hearing loss is extremely important, and it is possible. For those who have hearing loss, early identification is really the key. It is the key to successful outcomes, as we saw in the case of Pratik and his brother. Early identification, which is possible through universal systematic screening that focuses, of course, on newborns, which many countries, especially in this region, have done, but also following that during the preschool age and school age. It is important that they be screened for ear and hearing problems so that they can be identified early, and then they can be addressed using evidence-based, cost-effective interventions which are available in the field, including access to hearing technologies, rehabilitation therapy, medicine, surgery, also sign language, captioning, and so on. So it's important that early identification be followed immediately by these evidence-based interventions, which can ensure good outcome for children with hearing loss. Despite the fact that we have all these opportunities to prevent, to identify early, to intervene and address hearing loss, nearly 80% of the need in case of ear and hearing care, it remains unaddressed. To address this, we have to focus on integration. Integration of ear and hearing care into primary healthcare services so that services are available across the continuum of care from the community level right up to the tertiary level, and also integrated as part of school health, both for raising awareness, for identification, and for intervention. My colleague, Dr. Shirin Kiani, who's joining me today, she will explain a bit more about what resources WHO has to make this possible and what is most relevant to the region of Europe. So I'm going to hand over to Shirin now. Shirin?
Okay. So good morning, everyone, and thank you, Shelly. I am Shirin Kiani, the Technical Officer for WHO Europe on this topic. I'm based in Copenhagen, and we cover 53 countries in Europe and Central Asia. And I'm here to give you an overview of the situation in Europe. So next slide, please, Shelly. So in Europe, unfortunately, we have 6 million children of school age that have unaddressed hearing loss. Next slide, please. And 3 out of 4 people in Europe have unaddressed hearing loss, and how much that costs our society is a tremendous, staggering figure of $225 billion every year that we could be using for other things. So there's a huge amount of work that we can do collectively. Next slide, please. So there's 3 areas that Shelly had previously mentioned where WHO has a range of tools and where we still have a lot of work that we want to do with governments in the EU. And I'll introduce some of those tools and how they apply to children and school health programs. So the first big area, and the area we always want to put our focus on in public health approaches, is prevention. And this is, of course, very relevant for the EU because you already have regulations for devices and standards in place for smartphones. So you're not starting from zero, but there's still a little bit more or a lot more that you could do. So these are the 3 key strategies we wanted to share with you on prevention. The one on the left is the one on safe listening for devices and systems. It's our global standard, and we would really encourage your countries to align with the standard. So far, some of the EU regulations fall a bit short of the latest evidence, which we can find in this global standard developed with the ITU, and it's quite comprehensive, so we encourage you to explore it. The second one is the standard in the middle, the global standard for safe listening of venues and events, such as concerts. And countries like Switzerland and Belgium have already regulations adopting these standards or based on these standards. But so far, we've only seen a handful of countries promote this, and we would love to see much more adoption of this standard. And last, on the far right, we see the global standard for safe listening of video game devices and software. And thus far, there's no countries yet that have based their regulations on this global guideline. So it's an area really in Europe, as a global leader in hearing care, we would love to see adoption of the standard, and WHO is here to support you on that. And that would really help protect the hearing of many, many children who do gaming, as you know. So, in addition to the strategies and the tools we have, we also know that awareness raising has a huge impact on children, their parents, and teachers. So, we have a range of tools also targeting them and helping them be aware of what safe listening is. So, we have our Be Healthy, Be Mobile handbook, which you can see at the top there. We also have a set of very child-friendly cartoons. There's about 8 short videos that you can use in your school online platforms that are self-guided, that children can use themselves to learn more about how to protect their hearing in a very fun way. So we'd encourage you to consider those. Next slide, please. Thanks, Shelly. So after prevention, the other pillar we have is early identification. So this area is really targeting primary healthcare workers to help increase the screening and identification of children who may have hearing loss. And so there's a range of tools to train them. And additionally, we do have a set of flyers and communication materials that health workers can distribute to the community as well, to learn more about their hearing care. 2 other resources for identification, and the one on the left, the orange one, is actually a joint guidance on vision and hearing screening in schools. It's a very detailed, user-friendly, stepwise explanation of how to do vision and hearing screening. And it's also linked to our online TAP training as well. And for example, school nurses could be trained on it. And it's something, again, we encourage you to explore and see how it could be used in the schools in your country. Then one of the very exciting apps that will soon come out is the WHO Ears app that will be coming out in the next couple of weeks. And it's a tone-based app for school screening, suitable for anyone above the age of 5. And it's a very simple 15-minute training that anyone can get to know how to use the app. And then you can get started with helping screen children. Next slide, please. So the third pillar then is the evidence-based practices and how we can integrate what we know are the right techniques to protect our societies into health strategies and benefit packages and health systems level work that we can do. So the 2 resources in red are some of the key resources and the latest resources we're about to launch. The top one should be coming out in the next few weeks, and it's the package of ear and hearing care interventions. And it's really helpful to look at different levels of the health system, again, community level, primary level, secondary or tertiary level, what could be done at each level in terms of service delivery to strengthen your system. Then the resource on the bottom right is hearing aid service delivery approaches as well to help train frontline health workers on this. And we also have some research that we have done in WHO Europe and the country of Georgia through our office there with the government that has also reinforced many of these principles of trying to introduce systematic and universal hearing screening in school-age children to make sure the school environments are much more friendly to children with hearing loss through acoustically improved classrooms, having the supports they need in the classroom, training teachers, and assistants to know how to interact with the children. So there's a range of techniques as well in our Georgia report that we're promoting for hearing care of school children. So next slide, please. Another huge strategy that came out last year is WHO Europe's Child and Adolescent Health Strategy. It's running for the next 5 years from 2026 to 2030. And as part of that strategy, one of the concrete actions we're having is we're gathering the national focal points in the Ministry of Health and in the Ministry of Education in our 53 member states to get together actually this week for the first time to actually discuss how do we promote health in schools? What are the different techniques we use? What are the key issues facing our children in schools? And we certainly will have to see how we can strengthen hearing screening and early identification as well in school. So that's another opportunity for you to think about. Then in terms of hearing aid provision, we know in many countries it's less than ideal compared to the population need. And we've done 2 market assessments, one in Georgia, one in Tajikistan, and each of those market assessments has a specific chapter on the hearing aid market. Is there a demand for it? Is there a supply for it? What's the cost? Do governments follow any kind of standards for what kind of hearing aids enter the country? So, for example, in Tajikistan, we learned that the hearing aid market is extremely constrained because of the low awareness of hearing loss in society. There's limited audiology services, unfortunately, and the device costs are quite high for what is available there. So there's still a lot of work to do to make hearing aids more universally accessible. So thank you very much for listening. I would now like to hand it back to Shelly to close the session. Thank you, Shelly.
Thank you, Shirin. So to summarize the messages for this World Hearing Day, I would say that the prevalence of hearing loss, of childhood hearing loss, is on the rise. An action that aims to prevent, identify, and address hearing loss is essential. It is key so that all people, including those living with ear and hearing problems, have the opportunity to reach their full potential. And that's why we must work to make ear and hearing care for all a reality. Thank you.